wellness.com, and this is episode 2 of our Holistic Hivemind. Today we're talking with Kelly Legendre from the FertilityFix.com, all about Vitex and fertility. Kelly is the creator of the Fertility Fix program. She's a licensed acupuncturist and herbalist who's been helping women grow their families naturally for over a decade. After the birth of her son, conceived while following the first iteration of the Fertility Fix plan, she left her acupuncture practice to focus on helping make motherhood a reality for other women worldwide. Kelly uses a research-based approach to naturally optimize fertility through the combination of functional nutrition.
For inviting me to do this. I'm pretty excited.
Is one of those, everybody's taking it, like on all these online forums and blogs. It seems to be like the go-to. I'm really excited to kind of get an expert opinion on this, so we can kind of, weed through all the myths and find the actual truths behind Vitex. Why don't we start with really the basics? What is it, and what actions does it actually have on the body?
Okay, so Vitex is it's an herb that is native to the Mediterranean. It's a bush, a shrub that produces berries, and the berries are the part of the plant that are used medicinally. You're right when you say it's kind of, if you believe everything you read online, you would think it's the best thing for every single female reproductive problem ever seen by anyone, which is really not the case. I personally feel that it's overused quite a bit and is not really appropriate for many women that are taking it. The way that it works on the body is it actually works on the hypothalamus to stimulate dopamine production. So what that does is when your dopamine levels are up, it suppresses prolactin, and then that has a kind of a byproduct effect of raising progesterone during the cycle. So it can be useful in some women who are having progesterone deficiency issues, but I personally use other things to kind of see if we can get those things going naturally before I resort to Vitex. But yeah, that's basically what it does. Is it works through dopamine.
It's basically an herb for females then.
Right. Rodents that show that it can decrease testosterone levels and can also decrease sperm motility. So those are obviously two things that you do not want happening if you're trying to conceive.
Right. Now, in that aspect, we had a question in my Facebook group if it was estrogenic, and I have heard that a couple of times here in the case with Vitex.
It does have an estrogenic effect. It tends to raise progesterone and estrogen at the same time, which is another reason why I'm a little wary of prescribing it to everyone. A lot of women who are progesterone deficient tend to also be high in estrogen, so that's not really something that you want to happen, is for the estrogen levels to go well.
Right. Okay, so you said you don't recommend it for everybody, but what type of woman would Vitex actually work well for?
So when I use it in my practice, I use it pretty much exclusively for luteal phase defect, which is, for anybody who doesn't know, it's an issue where the luteal phase of your cycle is too short. So progesterone is produced during the second half of the cycle. So what that means is your corpus luteum is not fully developed. It's not producing the progesterone that it needs to, and so you end up with these short cycles, and you don't end up with a uterine lighting that's able to support a pregnancy. Although I will say I usually try other things first before I resort to Vitex. I usually try to do things that will naturally raise dopamine levels. Also, progesterone and dopamine have a similar precursor hormone in common, which is pregnenolone. And if you're low in pregnenolone, you can be low in dopamine and progesterone. I try to do things to raise those levels first. What Vitex does is it kind of forces your body producing more dopamine. And if you're already deficient in the things that you need to produce dopamine, if you're forcing your body to produce it anyways, then you become more deficient and you can end up crashing later. So, while I do sometimes use it in women with luteal phase defect who haven't responded to other methods, it's definitely not my first choice when treating that type of disorder.
Okay. So the other things that you do first to try and build up the dopamine levels, what type of things are you talking about?
So in practice, I really focus on first lifestyle changes. Pregnenolone is also used to produce cortisol in the body. So one thing that happens is if you have really high stress levels for an extended period of time, your body starts stealing away that pregnenolone from making dopamine and progesterone and instead uses it to produce cortisol. So really working on lowering stress levels. I feel like women have a tendency to kind of gloss over those recommendations for stress reduction and then move on to things that are more exciting. But they really make a huge difference. So meditation, yoga, just finding time for yourself, hanging out with your friends, laughing, whatever it is that you do to de-stress, that is hugely important. And then second to that is diet is huge. You need plenty of good vitamins and minerals to produce all of these hormones. You need lots of good fats in your diet. Sugar can actually cause dopamine deficiency because sugar causes your body to preferentially start manufacturing serotonin over dopamine. So cutting out sugar is huge. Cutting out caffeine because that raises cortisol levels, cutting out alcohol, all of the things that are going to be taking away the things that you need to make the hormones you want to be making. You need to cut those out, and then really focusing on a whole foods diet is hugely important for getting your hormones back into balance. Those are the two things I focus on first. Then also, in addition to that, working on replacing some of the nutrients that you might be missing for dopamine and pregnenolone. You need magnesium, zinc, B6, vitamin C. There are a whole group of nutrients you can add to your diet. They're going to help your body naturally produce those substances. So usually I go with those things first, and then after 2 or 3 months, we kind of see how things are going, and if you're still not producing the progesterone you need, then maybe at that point we look at using Vitex.
Now, what about for women who have PCOS or deal with anovulation or absent periods? I hear so often that women use Vitex trying to, to get their body to ovulate. Progesterone because they're not ovulating, so they don't know what that luteal phase length is. What do you suggest Vitex for them, or something completely different?
So again, PCOS responds so well to diet and lifestyle changes. That should be primary for anyone experiencing PCOS. So I really try to focus on those things first and see if we can get women to start ovulating on their own. And then, if you're not ovulating, you're not producing progesterone during the second half of your cycle, so you're going to be deficient in progesterone. But once we can get that ovulation jump started through diet and lifestyle, then very often things kind of balance out on their own. So again, it is something that is used commonly for PCOS, but it should not be, in my opinion at least, it should not be the first course of action. We should be looking at other things first, and then turning to Vitex once start to see some changes in other areas.
Okay, so for the women who would benefit from taking Vitex, what is the best form to use? Because I know you can buy your own dried berries and make tea. You can do capsules. They have tinctures. What do you find is the most effective way to actually administer Vitex?
So there are certain constituents of the plant that are better extracted through alcohol. You can, if you're worried about the alcohol in the tincture, you can always put it in a cup of hot tea and kind of let some of the alcohol evaporate off. But alcohol really does the best job of extracting the active constituents. Beyond a tincture, Gaia Herbs also makes a really nice liquid cap that's a glycerin-based liquid cap, but they have a process that they use to extract some more of those main constituents from the plant. So, I'd recommend either a tincture or possibly the liquid gels.
Okay. How do you know how much to take? Because I know, when you buy capsules, it'll tell you, so many capsules a day, or kind of the tinctures, how many drops. Is what's on the bottle effective enough, or, could women be doing something different?
Yeah, this is one of those areas where it's really to your benefit to be working with someone who knows the herb well, an herbalist or an acupuncturist who's familiar with it, somebody who specializes in fertility, or maybe a naturopath. Everybody's body's a little bit different, so everybody's going to react a little bit differently to the herb. I usually recommend 30 to 40 drops of a tincture. And you want to be looking for a standardized tincture. I can't think of off the top of my head what it's standardized, the constituent, but it's across the board. It's not like one product's going to be standardized for this thing and another product's going to be standardized for another thing. So if you're finding a standardized product, it's going to be standardized to the main constituent. But yeah, 30 to 40 drops. I know the Gaia Herbs, they're I think it's 1,000 milligrams that their liquid capsule is. So yeah, it just kind of depends on the form you're taking, and it's something you want to take first thing in the morning before you have anything else to eat, on an empty stomach, and once a day. That's the majority of the research has been done taking it that way.
The effect on the body, because I've heard it could be a few months, it could be 6 months to a year. So how long should someone take it before they finally see some changes?
At least 3 months. It is something that is going to take a little bit longer. You're not going to notice a difference in your first cycle, probably. So 3 to 6 months is probably a good time frame to give that. I would also recommend taking the minerals that I mentioned at the same time, the magnesium, zinc, and then vitamin C and vitamin B6. Just so you're providing your body with what it needs to be manufacturing the dopamine that the Vitex is forcing it to manufacture, because like I mentioned earlier, if you're taking it on its own and you're already deficient in the things that you need for its manufacture, then you're just going to make yourself more deficient by forcing your body into that when it doesn't have.
Is this something where you should take it your entire cycle, or do you just take it during the luteal phase?
I usually have patients take it just during the luteal phase. So starting on like day 15. If you're ovulating on day 14, I guess it is. You really you want to be tracking your cycles and then starting it the day after you ovulate.
Okay, taking other herbs with Vitex, because so often women will try multiple herbs at a time, or they'll start taking maca supplement. Should it be used by itself, or can you kind of mix them with other natural remedies?
Hard and fast contraindicated herbs to not be taking along with it. I will say maca is another one of those herbs I think women are really using right now, that it's kind of promoted online as being good for everything. The only research that's been done on maca in women is to raise estrogen levels postmenopausally to help with postmenopausal or menopausal symptoms like hot flashes and night sweats and things like that. So it's really, most women are, maybe if you're early menopausal or having like premature ovarian failure, something like that, maca might be an appropriate supplement. But for women that are low on progesterone, the last thing you need is more estrogen floating around in your system. So I don't recommend maca to anyone other than women that have signs of estrogen deficiency. So I would not be taking those two together. The other, I'm not aware of any medications that it's contraindicated for taking with, but I will say if you're taking synthetic hormones, if you're working with a reproductive endocrinologist and he has you on hormones, you really shouldn't be taking any herbs, because the herbs are meant to try to balance out your cycles and try to get things to kind of naturally, naturally be where they need to be hormonally. Whereas the prescription medications are kind of doing the exact opposite. They're supplementing things and trying to force your body acting a certain way when it's not doing that naturally. So taking herbs is really going to be counterproductive to taking the hormones.
Okay, so that gets rid of that other question that someone had about using it with medicated cycles. So yeah, probably best just to stick with either the medication or the herbs.
Right.
I can continue on. Some women wean off. What's really the proper way to take it and to stop taking it during pregnancy?
Right. So that's really something you need to be talking to your midwife or your OB about. There isn't any research that shows that it's safe during pregnancy, which is kind of, when we're talking about pregnancy, usually they're looking for research that shows that it's safe before anyone's going to recommend it. So it hasn't been proven to be safe. There's also no evidence showing it's not safe. The concern that I would have with somebody taking Vitex, getting pregnant, and then suddenly going off as soon as they get pregnant is really Vitex is kind of artificially forcing your body into producing extra progesterone. And since you need that progesterone at the beginning of the pregnancy, if you suddenly stop it and have no other source of progesterone, then it makes miscarriage more likely, because one of the big side effects of low progesterone levels is early miscarriage. So if you're going to be taking it, trying to get pregnant, definitely talk to your doctor or your midwife and try to figure out what you need to do once you become pregnant. I saying that people should definitely stay on it, but if that's the advice of your midwife, then that's what you should be doing. There are some other alternatives, progesterone creams, or even synthetic progesterone, just depending on your doctor's viewpoint and how he or she thinks that you should proceed from there. But yeah, it's definitely something you need to talk to your doctor or midwife about.
Okay. So one more question that we got from the group was about Vitex and breastfeeding, and wondering if Vitex was safe to take while breastfeeding. Does it reduce milk supply? Because since it kind of acts with or lowering prolactin, which is what you need for milk supply.
Right.
Does it harm that supply at all? And does it actually help to even bring back ovulation while you're breastfeeding?
Okay, so I'm not aware of anything that's shown that that it can bring back cycles during breastfeeding. It's kind of got an interesting action on prolactin. It has traditionally been used to increase milk supply in the period kind of immediately following birth, but does also at other times have the effect of reducing prolactin. So again, it's one of those things you're probably going to want to talk to your doctor about. It's going to depend on your individual situation. Again, there hasn't been really any research proving that it's safe or unsafe during breastfeeding. I'm always a little bit wary of using herbs that are going to have an effect on the hormones while breastfeeding, just because that's not really something you want to pass on. But again, it's going to kind of depend on the individual case, and that's something I would talk to your doctor about.
Okay, great. So is there anything else about Vitex and its use that I didn't ask that that we still need to cover at all?
let's see. I'm trying to think. I think we covered. I think we covered everything that I was thinking about. I'm sure I'll think of a million things once we once we hop off of the call here.
Yes, thank you so much for answering all these questions. And yeah, if we get any major questions, something that we didn't cover, I'll just kind of shoot you an email, and then we can just put the answer right in the show notes,
Okay.
so that we can make sure we've
Yeah,
got
and
it all.
you know, if we didn't cover, feel free to post there, and I'll be around and try to answer those questions as well.
Okay, great. And so that, I guess, we will wrap up with Kelly. And again, she is from the fertilityfix.com. So you can head over there and see all she has to offer. So, all right. Thanks, Kelly.
Thank you so much, Donnell. It was great talking to you.
All right.